It's the Eagle Community Television Forum with your host, Gary Shorman.
Hi everyone, I'm Gary Shorman, and this is the Forum on Eagle Television. Good to have you watching along as the Forum is brought to you by HaysMed. You know what? We have something exciting happening out at our medical center, and to talk about it is Melanie Urban. She is the Patient Quality Services Director at HaysMed. And Melanie, good to have you with us again.
Thank you. It's always a pleasure being here.
I always look at your title, and it sounds like a big job. Tell me about what you do at HaysMed. Patient Quality Services. What does that mean?
I've been at Hays Medical Center for about 24 years, and I'm currently the Director of Patient Quality Services, which entails hospital accreditation, patient satisfaction, quality, infection prevention, associate health. I think that wraps it up.
You have a bunch of stuff that's under that, but somebody out watching, you mentioned accreditation because we're going to talk about just something recent that happened at HaysMed. Hospitals operate with a lot of rules. They have a lot of things, a lot of standards they have to meet. And there's some that just every hospital has to have to stay in business. But then there's those other things, the accreditation process. How extensive is that for a hospital the size of HaysMed when you talk about being accredited?
Yeah. Being accredited for HaysMed means that you're following the rules set out by the Centers of Medicare and Medicaid Services. They have conditions of participation. So every year we have a survey. D&V Healthcare comes and surveys us annually every year to meet all their requirements in order to stay accredited, in order to receive reimbursement for CMS.
So the national, just to get coverage, and from the government, there has to be things. So you can't be a bad hospital.
No.
But one thing that's exciting here is that you've gone above and beyond all those things, and actually are one of 4 in the country to achieve the DNV's Healthcare Management Infection Risk Certification. What is that? Again, a lot of big words, but what is that?
Exactly. That is something new that DNV Healthcare is surveying hospitals for. They go around and do gap analysis where they come into your facility. They evaluate, I believe, on 18 standards to see where you're at and if you're eligible to sit for the survey. HaysMed was eligible to sit for the survey. We just had our survey in August. And like you said, we're 1 out of 4 hospitals that have undergone the extensive survey and are now certified in managing infection risk. And what that means is managing infection risk. That's just acknowledging the exceptional processes we have and the framework for managing our infection risk at our hospital that exceed the current standards. This is going above and beyond the bar and expanding ourselves to exceed the national standards. We were already meeting the national standards. Now we exceed them, which is what DNV Healthcare is telling us by giving us our certification.
We're going to talk to Kim Koerner in just a little bit about some of the specifics of that. But if you're out there watching, you know, sometimes in a community you hear things about what's going on at the hospital. But in this particular case, infection is always a risk, but the hospital has gone above and beyond that. When they come in, what does that do when people come in and do that sort of, I guess, certification process?
Well, it's kind of just a seal of approval from a company to come in because they come in and look at our outcomes. They look at all of our infection data. They actually come in and follow our nurses, our physicians around, our staff, and see that we're meeting all of their standards. They want to see how we take care of patients, how we're cleaning our equipment, how we're keeping our hands clean. They come in and do a thorough survey. They not only look at our data, look at our policies, they actually want to see that we're actually living this every day to minimize infection. Kim will get into more details, but just for example, in 2016, we've done over 7,000 surgeries, and we had 2 surgical site infections in 2016. So we really do a good job keeping our infections down at HaysMed, amongst other things. There's a lot of infection risk in a hospital, so we take that very seriously.
I know you go to the hospital and people aren't feeling good, so you have infections to deal with. And then you mentioned just some of the simple things like washing your hands, because that is so important, even in everyday life, to do that.
For everybody.
Talk about following nurses around and to see what happened. That's really, I'll say invasive, but it's people are there watching to see what you guys do, and to be 1 of 4 is pretty exciting from your chair.
DNV Healthcare has been coming into HaysMed for over 10 years. I think they started in 2005. We've been ISO certified with DNV since 2008. And they also come in and do, they have a hip and knee replacement certification they come in annually and survey us for, which we're surveyed for. We're a primary stroke center with DNV Healthcare. We also have a different surveyor that comes in and does chest pain certification, chest pain accreditation, and then we're also getting ready to make plans to sit for heart failure certification. So I think our staff are comfortable because they come in annually and they come in almost quarterly now to survey for different programs and processes. So I think it's something that we live every day at the hospital. It's just second nature to have surveyors coming in and looking at us. So I think everybody's comfortable with the process, and I think that's why we're able to exceed and get these additional certifications.
I'd ask a question, maybe because somebody out there is thinking the same thing. Why do you guys do this? Because it seems like it's a lot of extra work. Now, it does show the community that you're above and beyond, but it sounds like this is not an easy process to go through.
It's not an easy process to go through, but is it a positive way to make changes through our hospital? It empowers our staff to rethink and redesign our current systems, think more efficiently, to improve patient outcomes and make our care safer. All of this is about improving our patient outcomes and providing safer care. We have a great facility in the community, and we want the community to know that it's a low risk for infection when you come to Hays Medical Center.
One of the things I notice also is it's whether it be a sport team, you want to win, you want to be that, you want to be better. This kind of plays into that. You want to be better this year than you were last year, and this has not been a 1, 2, 3 process, because you started this back 2015?
Yeah, exactly. We had our gap analysis in 2015, and you need a champion, a physician champion, to lead it, and you also need someone to run with it, and that was Kim Koerner, who's going to talk momentarily. Our infection prevention officer at the hospital kind of led it, and then it was chaired by Dr. Gray, who's one of our hospitalists. She was really our physician champion. So it takes people from all levels to get involved and be empowered and be excited about it. We would not be able to sit for this survey if we didn't think infection prevention throughout our entire organization. And that's what they look for when they come in and do your gap analysis.
Somebody that's out there and they're saying, boy, this is really cool. Can you go and find out more? Because I saw this and it's like, wow, this is cool stuff. Yeah. How does somebody, other than watching a program like this, how do they find out more? Can you go to the website, or are there places they can go?
They can go to our hospital website, or they can go to DNV Healthcare's website and see all about their information and all the certifications. We have all of our certifications posted on our website, so they can go there at any time, or they can give us a call at the hospital. They'll route them, and we'll be happy to share any information or any questions that people have.
And I think probably some also to help if they have some questions or some specific things that they heard or don't understand. They maybe have a relative, someone they love in the hospital. Helping understand what goes into this also helps you feel better about the patient you have, the person you know that's in the hospital.
Right. We monitor not only our patients while they're in our facility, but also if they get, once they're discharged from our facility, if they go back to their primary care physician in their local community, we also follow just to make sure that they're not getting infections later on as well. And we're always in communication with other hospitals in the region on our patients. If they have questions, they'll call us. And so there's a way for us to track them not only while they're in our building with their surgery, but also their post-op, to make sure that things are going well for them.
Well, Melanie, thanks for joining us for the first part of the program, and congratulations, you're setting a high bar.
Yes.
And for people to feel comfortable and excited about being a part of HaysMed, if they have someone they know that wants to go there. And the website's cool, but you guys are doing a great job of making the hospital safer for all of us. So congratulations.
Thank you.
Melanie Urban from HaysMed, just our current guest. We're going to have Kim Koerner up next. Stay tuned. After this, from HaysMed.
HaysMed is your first and best choice for healthcare. They're the only facility providing tertiary level services in this region, with more than 70 physicians and 26 specialties ranging from heart, orthopedic, spine care, cancer, obstetrics and gynecology, wound care, rehabilitation and surgery, including the Da Vinci robotic surgery. HaysMed is your comprehensive health provider for people throughout Western Kansas. HaysMed, helping people be healthy.
Are you frustrated with Wi-Fi dead zones in your home? It happens when you don't have Boost, the cutting-edge Wi-Fi solution from Eagle Communications. A Boost-certified Eagle technician maps your home, then installs a dual-band modem and router, plus discrete access points to deliver wall-to-wall Wi-Fi with no dead zones. Boost powers all your family's devices in all the places you love to live. Get Boost. Wi-Fi made simple. Only from Eagle Communications. Call today.
Hi, and welcome back to the second half of our forum program here on Eagle Television. If you have any suggestions for great shows like this one, send them to me at gary.shorman@eaglecom.net. You can also go online on Facebook. You can find us under ECTV Forum. We've switched our guest here from HaysMed. Kim Koerner is here, and she's actually the infection prevention officer at HaysMed, and ties in with the story we just talked about. Kim, tell us a little bit about your job. That sounds really serious, infection prevention officer. What is your job at HaysMed?
Well, my job is actually to prevent infections, to not allow them to happen. So we put a lot of processes in place to work on that.
Yeah, I know we talked earlier about the certification just received on that. Mm-hmm. What went into getting that specifically? Melanie talked about some of the meetings that went on. I understand you also had a committee that you put together on risk and where those risks were.
Right.
Tell me about that committee.
So we actually created a management of infection risk committee. So what we did every week, we met to look at all the infections in all the departments of our facility, or the risk that existed in those departments, and talked about how we could really mitigate those risks. What could we do to make it less likely that when someone come in, they would have the potential of getting an infection?
So talk about some of the specifics. Somebody comes in, a risk, somebody has an accident where they cut their leg open and do that. What are the risks involved, and how do you manage something specific like that?
Okay, so very specific like that, it really would start when they entered the ER. You know, they do the simple things like flushing out the wound, they would start some antibiotics, and we do things like before anybody goes to surgery, prepping the surgical site. There's just some basic things that we would hope everyone would do, but what we did is we looked beyond that point, beyond what just was the normal standard. What could we do to think forward to really prevent these infections from happening when someone comes in the facility?
One of the things I know that you look at, whether it be hand clean or whatever, that you go into the day and you're saying, okay, how do you keep things clean? But you get a wound and that wound gets into your bloodstream, there's a lot more complications that go with that. How did your committee address that? Was it a group of, I know we talked about one doctor, or who all was involved with this committee to help find the answers to those problems?
When we're talking about specific infections, specific bacteria, fungus, viruses, we actually have...
All those sound bad, by the way. So, yeah.
We actually have in antibiotic stewardship, antimicrobial stewardship, that's all we do. We focus on the infections and how can we treat them and prevent them. So that's an actual committee that we've had for about 3 years now. And it's just starting to get moved to the forefront because of the big push to save our antibiotics so they work. So we really focus treatment for bacteria and any other kind of illness that might come into the facility.
Kim, you brought up an interesting point, because all of us have heard or read the headlines about those super bad bugs out there that antibiotics won't work with anymore. How does that play into this role as well?
So really, there's antibiotic resistant bugs, bacteria, viruses, funguses that live everywhere. We have been fortunate in the Midwest that we really still have strong antibiotics that work. What the antibiotic stewardship program does is they look at how well they're still functioning in our area for the bacteria, viruses, bugs that are living around here. And if we detect a problem, then we will address how can we fix it, how can we preserve these antibiotics. It might be shorter duration or longer duration to save what we have. So the problems that we see on the East and West Coast as far as antibiotics not working, we are lucky here in the Midwest that most of our antibiotics are working perfectly fine.
One of the things that we talked about, the certification that led to this whole conversation, took a lot of time. It started in 2015 and doing that. Tell us about the process and what you kind of learned from it, going over almost 2 years now of working to get to this certification. It's really cool. You know, one of 4 hospitals really in the world that are certified this way. Tell us about some of the steps that you took, some of the maybe exciting parts that it got into, and how the staff kind of accepted the process.
It was interesting. Anytime you're trying to change somebody's thoughts or their processes, you have to show them why it's important. And I must say, I was completely impressed with all the departments and employees at HaysMed. They were really excited. They really got it. They understand how important it is to prevent infection. So I had every one of them do a risk assessment in their department, bring it to our meeting, and let us know what they were doing to fix different issues in their department. And when I mean issues, it's not that they weren't doing good already, but what do we have that we could look at that would really go above and prevent infections? Then we kind of decided on, in each area, they decided what they were going to work on and focus on. And then as a team, we all worked together to help them achieve that.
DNV Healthcare was the company that came in and did the certification. They came in at first. They had recommendations, I know, to do that. Was that a long list? I mean, because
Yes.
was it a long list and hard to go through? I think Melanie said 18 some different steps or procedures and processes.
Right, there's 18 elements, and it absolutely touches every aspect of a healthcare facility. You're talking about food services, environmental services, your biomed department. How about our materials management department, where you're thinking, well, how could that possibly affect that department? But there wasn't a single area that was not touched or changed or improved in our facility with this certification and going through that whole process.
Well, you have to be proud of that, because you don't get certified if you don't make the marks and don't achieve the right levels in all 18 of those categories. So you have to be proud of your committee and the group for doing that.
You know, I was so impressed. I didn't really, there's a few moments that, you know, I was a little stressed out, but they really embraced this. They really wanted to look at things and make process improvements. And so I was really impressed, because I thought, you know, am I going to be able to get EVS involved in this? And do they understand how important, you know, they are in our process? But, you know, they go around every month and they test the environment to make sure they're cleaning appropriately. They created what I call a CART card, but it just tells every environmental service person how to clean the room that they're in. So they're all doing it exactly the same. So they're not having to remember what they were taught a year ago. They have that right in front of them every time they step into an area to clean. Am I doing what's expected of me? And then we go behind them and test the environment, and it validates, yes, they're doing the correct thing. So.
And then I assume that then circulates back to the committee. If it's not being done, what's the better process to make that happen? That's one of probably several things that came out of this whole process for doing that. You come from a background of a nurse.
Yes.
Because that's certainly another important role. How did nursing play into the protection from against bacteria? And
right. So I was a critical care nurse for quite a while before I transitioned over to infection risk. And I think working critical care, you really get, and not just critical care, I think nurses just generally understand the importance of preventing infection. And so you are constantly looking ahead. So you're looking at the state your patient's in, and what can you do to prevent any complications or problems down the road. So I think that was already ingrained in me. And then I just have to admit, I love infection risk, so it just seems like a good fit to me. I think it's important, not only to me, but I think the hospital has shown it's important to them that we prevent infections. We all know that anytime you go into the hospital that you automatically are at an increased risk. But we're working to be sure that you understand that we're helping to mitigate or prevent those risks when you're at HaysMed.
Well, I hope someone out there watching believe it's safe to be at HaysMed, to go to the hospital to do that. But many patients sometimes don't have a choice. They end up there. What should you look for if you're going into a hospital? Because you don't always have time to go to the website, look up to see what certifications are there. But what should someone look at when they go to their doctor's office, when they go to the hospital?
Are they washing their hands? That's the best thing you can do. If we did nothing more than good hand hygiene, we would save over 1 million lives a year. That's according to CDC. So I think people don't understand how important it is just to have clean hands, because we transmit bacteria and germs back and forth with our hands, and we touch everything. So if you really practice on washing your hands, and if you're a patient in a hospital or you're at a clinic, feel empowered to say, did you wash your hands? Let them wash their hands in front of you. It's really the best way to protect yourself.
And one of the things you mentioned, and we were talking about what you do, washing your. How many times should you? We talked about this earlier. How many times should you wash your hands a day?
I think everybody should be washing at least 100 times a day in healthcare. We encourage them to wash before they go into a room, before they touch the patient, when they come out of the room, anytime they put gloves on or take gloves off. So it's just a continuous process of washing your hands.
So if we want to say, hey, Kim, come on out to Eagle, tell us what we need to do. Washing hands would be one.
That would be my top number one. Mm-hmm.
And we're going into the flu season where a lot of
Yes.
germs, somebody in one part of the building gets something else, and doing that
Mm-hmm.
washing hand helps. Anything else you can recommend? Because obviously at the hospital it's a lot worse than it is at a business
Mm-hmm.
or even your home, but it still can help.
Right. So if you come into any of the main entrances at HaysMed, we have what I call respiratory or hygiene stations that I put out during the winter time. It provides tissues, it provides hand hygiene, that hand washing, and it also provides a mask. So if you have some coughing, sneezing going on, it's good to kind of keep that covered. So if you don't have a mask and you're just out in your normal everyday life, we say sneeze or cough into your elbow and always wash your hands.
Well, I'm glad you're here to talk about that because we are going into that flu season
Yes.
where that happens. I'm also proud of what you guys have done because it's not easy. It's easy to do your job, but it's not easy to take on these extra responsibilities to do. And the certification for this is really exciting because it's one of the top in the world, frankly, for being able to do that. What's next? What are you guys working on next out at the hospital? Because it seems like there's a lot of exciting things going on. Is this something that continues as certification, or are you done with certification at this point?
No, well, we received our certification, but they will come out every year.
And see if you're getting it done.
That's right, yes, to make sure. So we were initially surveyed on all 18 elements. When they come back, we'll get surveyed on half those elements, and anything that they always give you opportunities for improvement or areas they feel like you could still improve on. So then they will check and make sure that we did make improvements. So it'll be a continuing process. And things change all the time, and we're always striving to do better.
Very good. Kim Koerner is our guest. She's the Infection Prevention Officer at HaysMed, and obviously a critical part of keeping you safe when you come to the hospital. Thanks for watching the forum here on Eagle Television. Melanie Urban was our early guest, Kim Koerner right now. And thank you for watching. The program's brought to you by HaysMed and by Eagle Communications, our community connected.
It's a beautiful day in our super high-speed internet great customer service neighborhood. Like you, this is where we live. In fact, our company is employee-owned, so it's our goal to improve the quality of life for everyone in our community by delivering faster, more reliable internet, clearer, more feature-laden phone service, quality TV channels, all with the level of customer service you'd expect from people who are your neighbors. Eagle Communications, our community connected.